Women in sub-Saharan Africa die of cervical cancer at rates that are more than 10 times higher than in countries like Canada. This is a tragedy because cervical cancer is totally curable if found early. I'm Dr. Karen Yeates, and I co-direct the Office of Global Health at Queen's University. Although I'm not a gynecologist, I'm deeply interested in improving women's health, and I've been collaborating with colleagues in Kilimanjaro, Tanzania since 2007 to try to improve access to care for women's health issues. Through my collaboration with the team of Dr. Olola Oneko, a gynecologist at the Kilimanjaro Christian Medical Center, I've learned about simpler and safer ways to screen women for cervical cancer in that low-resource setting. This is my grand challenge. In the developed world, the gold standard for cervical screening is the Pap smear. In Africa, Pap smears are virtually impossible because they lack the pathologist to read them, and more than 70% of women live in rural areas away from medical specialists. Visual inspection with acetic acid, or VIA, is one of the methods that's currently used in low-resource settings to replace the Pap smear. The problem with VIA is that healthcare workers who are trained to provide this service can lose their inspection skills over time if they do not receive ongoing training. If a health worker loses their VIA skills, it can mean death for a woman who has come for screening and has been told that she has no cervical cancer when she actually does. My gynecologist colleagues in Tanzania have been studying a technique called cervicography. Cervicography involves a simple photograph of the cervix with a camera that allows the user to then view the photo on a simple television screen at higher magnification. The photo of the cervix is then inspected and graded by an expert who's trained in cervicography to recognize early cancers. Cervicography can be offered to women even in remote villages through the use of a cell phone application that has a patient tracking program that sends text messages to cervical images to trained specialists in specialized health centers. The beauty of our bold idea is that within minutes of receiving the text and through the use of a mobile phone, our trained experts at Kilimanjaro Health Center can text a message back to the health worker with instructions about treatment